Brought to you by Agilus Diagnostics.
Agilus Diagnostics.
Recently, a study was conducted on childhood cancer. They tried to look at which cancer actually takes the maximum time to get diagnosed. Recently, a study was conducted on childhood cancers where they tried to look at how far a parent has to travel to reach a center where the cancer of his or her child is treated properly, adequately, and timely. They also tried to look at how much time it takes for a cancer to be diagnosed in a child. Do you know which cancer came out as the answer to both these questions? It was sarcoma, or a tumor or cancer of bone and soft tissue. Yes, it took the maximum time for a child to be diagnosed with a bone or soft tissue cancer as compared to other cancers. Also, the centers that treat bone and soft tissue tumors or sarcomas are rare, few and far between, which is why the parents had to travel the maximum distance to get their child treated. So let us understand what sarcomas are. Sarcomas are cancers of connective tissue, that is, tissues such as bone, muscle, tendons, nerves, cartilage, and so forth. A sarcoma generally presents as a mass or a lump in the lower or the upper limb. These lumps can be painful or painless, but they keep growing over time. We broadly classify sarcomas into two types: sarcomas of bone, which are painful, increasing masses, more commonly found in children and young adults, and they also lead to restricted joint movement and a painful limp. On the other hand, soft tissue sarcomas, which do not affect bone but affect muscles, tendons, and other soft connective tissue, is more commonly a painless growing mass, and they are more commonly seen in adults as compared to children. You would wonder why sarcoma happens in the first place. In most cases, we never know the exact cause that leads to sarcoma in a particular patient. But in some cases, we do know that exposure to radiation, for example, radiotherapy for treatment of other cancers, or radiation exposure from some other source, exposure to certain chemicals, and affection and being affected by a genetic disorder can lead to sarcomas. So how to diagnose a sarcoma? Generally, you should be seeing a sarcoma specialist or an orthopedic oncologist if you think there is a lump or a swelling in your hand or the upper or the lower limb, especially if it's increasing in size over time. The red flags that we often tell everyone is that if it's a swelling that is more than 5 centimeters in size, it is deep, it is increasing in size over time, and or is painful, one should suspect sarcoma and reach a sarcoma specialist. The doctor or the sarcoma specialist generally would do a thorough clinical examination, may order imaging such as X-ray and an MRI, and if the suspicion is high, they would often prescribe a whole body screening such as a PET scan or a CT of the chest. Once investigated, the sarcoma will be diagnosed finally doing a biopsy, which most commonly is an outpatient procedure under local anesthesia. After diagnosis, a multidisciplinary team will generally decide as to the best course for the patient, and sarcomas most commonly will be treated with surgery and sometimes also with radiation and chemotherapy. Friends, sarcomas are curable, and nowadays not just lives but also limbs can be saved by appropriate diagnosis and a timely diagnosis and a correct and timely treatment at a specialist center.